Hello, everyone. So, the topic for this week is public health informatics. Let's see what we have objective for this lecture. So, I will explain the public health and that how it's different and related to the public health informatics. We will then discuss the importance of informatics to the practice of publicly health and the role of informatics with the public health agency, like why we need public health informatics and where we are using the public health informatics. Afterwards, we will see the public health surveillance strategies, some examples like what type of public health informatics uh, approaches are existing in the current healthcare system. Then we will discuss about the data source and geographic information system. Here I will list several common data sources used in the field of public health for surveillance. And you will see I will share a couple of videos during this lecture, and based on the videos I have activities for you, and you will submit these activities on Canvas. I will explain later as we move on to the lecture. All right, now, so the question to all of you: what is public health and what is public health informatics? I'm sure you have heard the word public health, and probably you are familiar with the word public health informatics. Even if you are not, just write something what comes to your mind when you just heard or read the word of public health and public health informatics. All right. So when you are just pause this video, write the your whatever comes to your head, and then resume this video. And now we will see what you had the idea and what actually the public health or public health informatics is. All right. Now, public health. So we defined public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices. Now you see that just like my previous lecture with the EHR and clinical decision support system, I have dissected the definition and then I color coded that for your better understanding. The same as with public health. You see that the part number one, the science and art of preventing disease. Okay, science and art of preventing disease. Why? To prolong life and to promote health through the organized effort. How? Through an informed choices. How we can do the informed choices? Again, if you just remember from data to decision. When we have the right data, right information, if you see the clinical decision support system, if you can go back to the previous lecture, you will see the 5 rights of clinical decision support system, that when we have the right information from the right people and information will disseminate the information through the right channel in the right format at the right time, and then the people would able to take the right decision. So the idea is public health is it's a mix of science and art that helps to prevent disease and also improves our the prolonged life uh, by promoting health through organized effort of the informed choices for society, public, private community, and individuals. This is how we define the public health. Now again, I just stop And whatever you got from this definition, you can write on your notes. All right, so when you are done, then again resume the video, and we are now here on the overarching goal of the public health. Like, what are the main objectives or motive behind the public health? So the first one is to monitor a variety of medical disease and conditions, like how we can, at the society level, at the public health level, at the New York City level, at the New York State level, at the East Coast level, like the community level, we can overall monitor a variety of disease, that how the diseases are going. Just take, I think, at this time, the common example of the COVID. We can take the COVID example, that how it's progressing, and how it's spreading from different part, and how the particular community and the people or neighborhood, uh, they are really tackling that well. Second point is to rapidly and accurately detect, prevent, and mitigate the spread of epidemic. uh, this is like how accurately detect the severity, uh, then define the modes way to prevent and mitigate the spread of epidemic. And thirdly, to monitor the effect of natural disaster and bioterrorism. Like, uh, these two are interrelated, and then this is relatively different. For example, in case of natural disaster, then there are some spread of disease, just like the cholera and the other disease. And if in any case of bioterrorism, if any disease like skin disease and other diseases, like the disease about the breathing disease, if that happens, then what would be the way out? What would be the strategy to um, to handle such kind of bioterrorism? So these are the overarching goal. Of course, these are quite broad, if you can see. Uh, and but these are the things which at this time the public health is taking care of. Okay, now I have edited this video. This video explains excellently about the public health, and you will get grasp the complete idea of whatever we have discussed. And in addition to uh, with an examples, please watch this video and take notes. Must take notes, whatever you can get out of that video. This will, when you will combine your notes with your reading and with whatever I am explaining, you have the clear idea about the public health scope and the definition. So when you are done, like in 5 to 10 minutes, this is the activity. When you are done with that, then you can move on to the canvas, or you can finish this the entire lecture, and at the end you can do the activity. So from this video and whatever I have discussed, there are the questions that you have to answer as an activity on the canvas. Like, you have to describe the public health intervention mentioned in the video. Then you have what could be the other possible public health intervention to prevent disease, which are probably not mentioned in the video. You have to go and search on the Google and can that information. The second point is question is how public health is playing its role in prolonging life. Support your answer with two examples. This answer may be you can quote the examples that they have explained in the video, or maybe you can search and the examples and quote. Maybe you can, the two is the minimum number. You can quote more if you want. Thirdly, they explained how public health is helping to decrease overall healthcare spending. This is very important question that probably you need to look at the numbers and answer this question with examples that you have. All right. Now let's look at the public health informatics. So what we have discussed so far, we discussed the public health, right? We did not discuss the informatics part, that when we have the public health data, then how we can analyze and deal with public health data. So just like the public health informatics also they have its overarching goal. Um, Now let's look at uh, the definition. So if you see this Venn diagram, you see we have this circle with the medical clinical sciences, right? So this is the medical clinical sciences or health sciences, you can say. And then this is health informatics and data science. This field we discuss about the data analysis technique, understanding, interpreting of the data. Then we have the population and public health sciences. And the intersection of all these circles, we have this one, we call that the public health informatics. So if we explain that public health, in short, we can say the public health informatics is the effective use of information, right? Effective use of information and information technology. We have a lot of data here, lot of information here. But the effective use of the information and information technology to improve population health outcomes. Now, what is the health outcome? Health outcome. Write on your paper whatever you have the idea about the health outcome. So the public health in general, just to remind you, focus on the health of population and community. Now, the effective use of the information that we collect from the community and exploiting or reusing or using that information using the latest state of the art information technology tools to improve the public health and health outcomes that we call the public health informatics. All right. Now, health outcome. Health outcome, how we define that? The health outcome is the study which seeks to understand the end result of a particular healthcare practice and intervention. Now, what would be the possible outcome? Like the when the patient uh, admits to a hospital, the maybe the patient will get a successful treatment, discharge. Maybe the patient will go like for the readmission. Maybe the mortality could be the result. There could be a passive several the result of that outcome. Now you see that how we can improve the like just take the hospital readmission process. How we can decrease the hospital readmission process, right? By carefully planning how we can improve the process, like triage process and the process of the care delivery process. Then what happens, what procedure we can take when we get the mortality, how we can decrease the mortality. You see that at this time 75,000 people die in the US because most of it and disease which are mostly preventable according to the CDC. So is there a way that we can decrease this preventable disease death? And same as hospital readmission, with the Medicare and Medicaid, it's a really a burden on the shoulder of the U.S. economy. If we could somehow find improve or optimize the procedure, it could help in the reducing the hospital readmission. So the public health informatics know the role and goal and objective of public health informatics. The overall goal is to measure, analyze, and compare a healthcare outcome is to achieve these quadruple goals. Like we can measure different procedures, get the data, analyze that, and compare different hospitals, different healthcare facilities. First is to improve the patient experience of care. Patient of care. So this is the number one. Second is to improve the population, improve the health population by reducing the per capita cost of healthcare. This is the second point. And third is the problem, especially with this COVID stuff, the clinicians and staff burnout. How we can decrease uh, the load on the clinicians and the others, the staff burden because of this informatics EHR part. How we can make it easy, automate that so that they could focus more on their procedures. So these are the goal of the health informatics. The goal measuring, analyzing, comparing healthcare outcomes is to achieve these quadruple aims of the health. And this is according to the Picori. You can just type on the Google and you can get this. Go to this website. This is the an organizations about the clinical health outcomes in the US. And just to give you an idea that why the healthcare informatics is important, healthcare informatics save a lot, tons of money, which we can reroute that money for to provide other facilities, to for the better roads, for the free or cheaper healthcare. Healthcare spending at this time in the US is over 5 trillion, according to the CMS Gov. 5 trillion. You know the 5 trillion. If we see the word, even like the two times the worth of almost these companies. No, these are touching to a trillion. But I mean, if you see that, so this is how uh, big the spendings are, and we definitely can reduce this spending and can save a lot of taxpayer money, and they can reroute to the for the better projects now. And question is, this is the question, with this staggering healthcare services cost, everyone, we are paying around like several $100s every month for our health insurances. Are we getting the quality value of the clinical care which it should be, which is according to the money value? The question is, no, we are not getting the value of money which we are spending. uh, there are several reasons, and here comes informatics. Informatics definitely can help. It could not solve the entire puzzle, but definitely it can add value to reducing in services level cost. And this is what I was just saying, like around 200K to 400K preventable deaths every year in the US. And this is the chart you see: disease of the heart, cancer, chronic lower respiratory disease, stroke, and some unintentional injuries. And this is the how. And these and around thousand, more than thousand people's, they die because of these preventable deaths. And with the informed decision, with the proper decision, with the proper management, with proper flow of information, we definitely can decrease the overall uh, cost, overall the death toll, and can improve the quality and value of the patients. And but you see the challenge. If you could remember the our first lectures where we discuss about the growing data in healthcare. This was a slide I show you that in 2012 we have around 153 zettabyte of data. Now around 2020 and this year we have more than 2300 zettabyte of data, which is 1 zettabyte is equal to 1 billion gigabyte. And on top of that, the data which we get, that one thing is the volume, and velocity mean it's increasing very, very fast, very, very fast. And variety with the different skills, some image data, some audio data, some video data, some different types of data. And this different source of the data, like some are authenticated sources, some are the sources which are not very authenticated. Some data has a more value, some has a less value, and variability of the data. So we have these 1, 2, 3, 4, 5, 6 variables, and that's called even the 6V of big data. And So it's not easy, even the informatics techniques, even you have some domain knowledge to effectively analyze the data and to fetch the information. There are always challenging involved, but it does not mean that it's there is no possibility. Definitely, that we have to work on the techniques, and we have to learn or improve the current algorithms to handle this gigantic flow of information and to extract the data which is which we need for the informed decision. Okay, and now when we say the big data cloud lead to a better care with a lower cost, then how we can help with that. This is also the diagram I showed in my earlier slides. Like, this is the healthcare data, and healthcare data is being generated like in the generic databases where we have the data about the DNA, protein, and other data, research studies, patient portals, smartphones, wearable devices, public health record. So this I already have explained in the lecture 1 and 2, that this is how the big data uh, is expanding. And healthcare record is a digital version of the patient from paper chart, as we see discuss in detail about the EHR part. The EHR information, we know that contains the patient medical history, diagnosis, medicine, treatment plans, immunization dates, allergies, radiology, etc. Right? So why we cannot compare, contrast different patients of data, like hundreds and patients of data, see the progress, that how if we give them a one drug, then how this drug is affecting them, how it's helping in their treatment, or on the other side, that how the certain lifestyle, and how the certain even the drug, how it's not helping to, or it's the hurdle in part of their cure or the treatment. So this kind of information is there. The need is to explore that information with the new available informatics technologies. And then it comes to the public health core function, just like we have the core functions of the CDC, sorry, the part of the clinical decision support system. We also say the public health had three core functions. One, the first is assessment. I remember with that IPA assessment, and then we have the policy making, and then we have the assurance. Now, what is the assessment mean? The first part is we have to understand that public health agencies spend most of their time and resources on investigation of potential threat to public health. For example, uh, most of the organized they plan activities which include the testing and monitor of the water quality. You see, we have several water testing units around. The time to time they take the water samples and take that, like how is contaminated the underground waterways. The second is lab examination of the disease carried out by the something like mosquitoes, right? And the tracing the content for individual exposed to a disease, as well as hazardous chemicals. So the idea is the assessment part take the most of the 30 to 40% of the time of the public health agencies in an investigations part. When they are done with their assessment, when they have the initial idea, then they will go towards the policy development. Policy development so healthcare agencies at this point create policies and regulations to protect the health population. Like, what could be the policies of that? Like, for example, the if they got the idea from the water, or they got the idea from some mosquitoes and the disease progressing, they can say, for example, the children may be required to have certain immunizations before they can attend to schools to prevent disease outbreak that would harm the children. Just like we have the clear case of the COVID. Like, we will open the schools, and when we achieve the 85% of the immunizations in the school, in the faculty and the student, right? So now this is the policy, right? So this was the assessment. and based on the assessment they say no, we have to make some policy, and then we have uh, to now the time comes to the assurance that how we can monitor that, and if someone is not following, what could be the actions. Here comes to the law. The once law and regulations are passed to protect health, public health agencies are tasked with assuring and compliance. For example, if the local health department may perform housing in house infection inspections to see that whether the landlord and are complying with the rules concerned with the pest control, right? Or several others. Like you see that they go for to the restaurants to check that the different foods, opening the refrigerators and checking there that how fresh the food is, and to check all that. So these are basically the part things to remember: assessment, policy development, and the assurance. These word you should remember and should write it somewhere, and you have on your notes with your explanation whatever you got from this and whatever you will read from the book. Assuming you have now these thing written on your notes and you are ready for the next slides to look at. Now here I have added another video which is explaining the role of informatics in public health. Very, very interesting video. And please, again, spend 5 to 10 minutes watching the video, taking your notes, and then, adding your notes to the to your to wherever you to write that, and then it is coupled with the activity part 2. And here, after watching this video, you will answer how informatics helps to provide right information at the right time for the policy decision making. Basically, this would be the answer that would couple with the EHR part, with the CDS part, plus the whatever you will get the information from the this video. The second part, you will list and explain the 3 use cases where informatics are helping in the current COVID-19 pandemic. Like how you see that the around now you have the idea that how we we are making the informed decision in the COVID pandemic. This is when you will watch this video, read this thing, also do some research, you will have the clear idea that how the informatics are helping could possibly help uh, for the in the COVID-19 scenario. So this activity round will take your 25 minutes, and afterwards you will go to the public health surveillance. Now, public health surveillance part. In this part, we will cover the techniques, or you can say the types of public health surveillance. So the public health surveillance we define as the systematic collection. You see this the word. Just pay attention. Systematic collection. Systematic mean there are some criteria behind, right? If we collect the data from which part to which age category to which ethnicity. An analysis, interpretations, dissemination, health related data is the bedrock of the public health practice, right? Then this is because the surveillance system capture and manage the volume of data and information necessary to support the 3 core function of the public health. That would lead back to the 3 core function of the public health that we have just discussed. Now, if we see the goals of public health surveillance, so these are some goals which I have listed over here. For example, it helps to estimate the significance of the problem, like how severe the measles, the outbreak is, how severe the COVID situation is in particular county. Then determining the distributions of illness, that how it distributed that, like in the age wise, like the people is affecting the age of the people from 60 and above, or under 15, and then community different, like his Hispanic Asians, that, and if it's targeting, so this need to be figured out. Then outline of natural history of disease, that how the disease, like it's natural history, how it progress, how it goes, and is there any the comorbidities, is there any other diseases the people they have in diabetes and heart disease, and how the COVID-19 affect to those people comparing with those who are healthy individuals. Then detecting the epidemics, right? Early detection, detecting the change in infectious disease, like you see different variant. We have the delta, now the delta, some more variant from the delta. Monitor changes in the health practice and behavior. Overall, check the that how it's going over there in the healthcare system. Then also assessing, evaluating, monitoring the quality, safety care of the drug, devices, and diagnosis procedural, PPTs, PPs, and the other stuff, and other, whatever being used in the medical and healthcare setup. And last but not least is for the public health planning. So these are some high top, you can say, the public health surveillance goal. Now, surveillance systems. There are different kind of surveillance systems. Here I have mentioned the case-based surveillance, syndromic based system, then Sentinel system, then behavioral type of surveillance system, then the integrated disease and clinical outcomes that are linked with the with the mix of these systems that are in the first row. Okay, now let's go one by one and look with examples that how these systems work. Case surveillance, at name suggests case based, right? Collect data on individual cases of health event or disease with previously determined case definition in respect to the criteria for a person, time, place, clinical lab. For example, if we get like the measles spread, if we get the any new disease or emerging, or we court cases reported that, then going there, collecting the data about individuals level, or then with a predefined category, with a predefined criteria, right? And then analyzing the case count rate, that how it's progressing, frequency, then the trend over time, right? So the like geographic clustering, so this kind of information we do with the case. And then historically case surveillance has been focused on the most public health surveillance. Then how historically, if we can look at the flu, like from the Spanish flu to here, the flu history, then how this kind of disease progress and effect to the community. So that's the case surveillance. Now, syndromic, you see again the syndrome, right? Now, I mean, what is syndrome? I'm sure the people, those who have the medical background, have the idea that what the difference between disease and syndrome. In general, you can say the syndrome is the array of disease like that, comorbidities and disease that are have affecting multiple pathways. Okay, now, so in syndromic surveillance system, we collect data on clusters of symptoms and clinical features of an undiagnosed disease, right? So we probably not only just focus on one disease comparing to the just one case, but we are relating disease as well, because we are not sure what is the nature of the disease completely. The second point is data can be obtained through specific surveillance system, like we have as well as existing epidemiologic data. For example, data could be collected for syndromic from the EHR, from the clinical claims data, from the work absenteeisms, schools claim, like someone has the chest infection, someone has the pain in the foot particular part. We can collect the data, and we can then correlate and the data from different data points, and can go for this surveillance. And geographic clustering, similar to the case surveillance, we can also do the geographic clustering here. Syndromic surveillance can also be used to track the longitudinal data and monitor the disease trend, that how the disease is progressing. Uh, the We can say, if we can define the syndromic data, we can say is the investigational approach right? So focus on the investigation, where health department staff assist with the and work with the people, those who know the data and those who know the techniques of the data, to automate the process of acquisition, so that they could generate the statistical alert based on that. What could be the example of that? For example, like the neurological syndrome, we have the rash associated illness, we have the respiratory illness, we have the febrile fever illness, just like influenza like illness. So this kind of disease, you see that these are not the disease like you can say the pandemic. These are disease which could be which are non-pandemic pandemic type or epidemic type. So this could be done with the help of the uh, syndromic. Now the Sentinel monitors the rate of occurrence of a specific conditions to assess the stability or change in the health level of population. For example, the positive side of the Sentinel surveillance could be it helps. It is very useful to monitor and identify suspected health event or disease. On the other side, if you see that it's a less reliable approach comparing with the syndromic and others, uh, since the data collection is limited to the specific geographic area, because as we are not take the area like entire country, community, or wider population area. So the because of the sample set, smaller sample set, this is not considered to be a very reliable approach. Now, the behavior surveillance, like uh, the collection of data of the health risk behavior. What could be the health risk behavior, right? I can give you one example. The other two examples you can write, like smoking and health access in relation to the chronic disease. With the behavior surveillance system, we can analyze the prevalence of behavior as well as the trend in the prevalence of the behavior over time. And with that information that we can collect, it's extremely useful, most commonly collected by personal interview and exam, and it could be really helpful to to analyze the current condition and to predict even what could be the future disease the person or the individual could have with the current behavior. So the one example I gave, that one bad behavior example is the smoking. What could be the other two? You should write over here. No, the integrated disease surveillance and response (IDSR). Basically, as its name suggests, it is a mix of the approaches that we see, that like sentinels, we see behavior, sentinel, syndromic. So it's a mix of the approach. Incorporates epidemiological and lab data in system designed to monitor communicable disease at all level of the public health. For example, this could be as this approach is the mix of the several approach, and that's why it's useful for detecting, registering, and confirming individuals' case of disease, and also help in reporting analysis and providing the feedback, and even preparing and responding to the epidemic. So you see that we can check, monitor the behavior, we can monitor the syndrome level, and we can use the mix of the techniques which we discuss here. Also, the variety of the information analysis and information gathering and dissemination techniques to within this IDSR. Clinical outcome surveillance. Now you have the idea about the clinical outcomes, like for example in the hospital, how many people they get discharged, and healthy discharge, mortality, readmission. So these are the surveillance. This overall can help us to monitor and the quality, or monitor clinical outcome to study the disease progression or regression in the population, like a certain disease, like how many people with the COVID, when they admit to the hospital, they come out healthy, or they disease, or what could be the other outcome. Analyze the rate and factor associated with the clinical outcomes using descripting and maybe sometime the inferential method definitely help to get the idea, insight, and based on that we can predict using different stats technique, probability techniques, or machine learning techniques uh, with that, and that could ultimately help in reducing the medical errors, improving the health, and also reducing the cost of the healthcare. Now, some surveillance we do based on the labs. For example, randomly or anonymously, we collect the data from the public, with which routinely conduct the test for virus, bacteria, and other pathogens, just to check that is there any, with random sampling, is there any certain pathogen exist in the blood. Uh, RBC and others, used to detect and monitor the infection, and also like foodborne disease, on standard method for identifying the reporting the even we can look for the genetic markup, like if the for example have a certain gene expression, or we see the upregulated genes just like BRCA2, BRAC2, and the people then will have the chances for the breast cancer in future. So this is commonly used, in a case with the case surveillance and Sentinel surveillance method. So this is, you can say, is a type, or this is one way of the surveillance that we use in the case surveillance, in the Sentinel surveillance techniques. Now, this will come to the activity, which is part three, and this is 4 point. And what you will do, that you will download this document, and after reading this document, you will answer to this question. Explain in a paragraph what public health surveillance and strategy explained in the report. Then, what do you think? What could be the additional public health surveillance? And after reading this, you will have a pretty good idea, and then you can go on the canvas and write your answers as an activity. So we have the total three activity, like one activity part of the like part one, part two, and part three. All right. Now this video is very informative. So please watch this video again. The same procedure, take 5 to 10 minutes, write on notes what you get over there, and then read the book, read the slide, and then you have this basically explaining whatever we have, the techniques here: behavior surveillance, sentiment surveillance, and also they say that how these techniques are working or in action, with some examples. All right, so hope so you have the idea so far with the public health surveillance, then different techniques of the surveillance, and with the you have with as you are already have done with the activity one, two, and three, you have a pretty much idea about the this topic about the public health informatics. Now with the similar topic with the geographic information system. Geographic information system, as you see that, here we have at this time, the you can get example of the Google map. It was started with kind of hand drawn maps, and in 1855 Dr. John Snow created the simple map, and just to outline the cholera, like where is there have the cholera. You see that at this time we have everything is digital. You can plot over there, you can overlay, you can make it a red, green, blue. So at this time, as with the digitalization, these things are very easier at this time to show that. And this is with why we need the graphic information system. This really make the things simpler, easier to understand. Even the people, those who are not with the domain, like consider that you are presenting you to a mayor of the city, presenting to the state governor, then how the people will understand that. But you see that with this example, if you can see that this is pretty parsable and easily understandable, even the people those who are not informatics domain, right? So that's how we generate the heat map, your geographic information system map within the healthcare, public health informatics especially. Now, challenges. There are a couple of challenges involved with the PHI, public health informatics. One is these systems data need to integrate disease that affect the animal with the human data. Like at this time, this is the area which is not pretty much explored. Let just consider the COVID with the human, and then its effects on the animal are, still at this time the people are even looking for the root cause, like from where the COVID started. It came from animal to human, or human to animal, or so this data, as we don't have this integrated data, this need to be looked at. This is the one challenge. Then we need to enhance the global response to outbreak, like because of the slow response, like the and slow enforcement, we see a lot of deaths here. Improve communications between the health entities. For example, like the COVID outbreak, whatever the organizations working in response, they should be interlinked and they should act very, very fast. There is also need to develop better diagnostic tool for earlier detection. We can see in the COVID case we have now the 15-minute test, 5-minute test, but you see at the beginning it has only like we have only PCR test available. It takes like a couple of hours today. So conclude this topic, what we have learned so far, we discussed the public health informatics, and the public health informatics we can say is an important part of the health informatics landscape. Then public health surveillance is a backbone of public health to detect and track natural disaster to the bioterrorism. Then the importance of geographical information system can provide map the importance of health data overlays, and new public health programs will continue to evolve that will require informatics to analyze, disseminate, and store data. Hope so you have learned something new about the public health informatics. I will see you all in the next class. Thank you.